reality.
I don't understand how someone dies during a wellness check. I'm pissed, I'm outraged.
That outrage from so many led to protests this summer in Canada and beyond.
Police are they're not mental health professionals.
We're the wrong entity in the first place. There's a space in there for somebody other than a uniform.
What's your fear?
My fear is that nothing changes.
At St. Paul's Hospital in Vancouver, the team is doing detective work on the long-term effects of COVID.
It does make me worry, what about the rest of my life?
Do you think you still fall into the category of recovered?
I still feel the impact of the virus in my body. I still feel permanently changed.
Hello, I'm Donna Friesen. Welcome to The New Reality. Tonight, we're examining a part of policing that's intended to help those in distress. But as we know from some tragic, high-profile cases, can escalate into use of force and death. They're called wellness checks. Police called to check on someone who is feared to be in the midst of a mental health crisis. But mental illness is not a crime. Tonight, Farah Nasser explores why wellness checks go wrong and what could make them right.
It started as a call for help. Ijaz Chowdhury was 62 years old and suffering from schizophrenia. His family was worried he wasn't taking his medication, so they called a non-emergency line in June. The father of 4 was shot and killed.
We're here saying, listen, we need your help. Let's go and de-escalate the situation. What are we told? Be patient. Everything's going to be fine. We're not going to hurt him. We're not going to use any force. And you can clearly see the result of that.
Within 3 weeks, 3 high-profile cases of Canadians, all in mental health distress, all from racialized communities, ended up dead.
This is my sister. She means so much to me.
Regis Korchinski-Paquette fell to her death from her Toronto apartment building on May 27th while officers were in her home. Police were later cleared by an investigation that her family disputes. In Edmundston, New Brunswick, officers went to Chantel Moore's home to check up on her in what's called a wellness check. Police say Moore charged at the officer with a knife. The 26-year-old was shot dead.
We've been hurt many times. How can we ever trust any police force? Why should we even answer the door for a wellness check? How in the hell did that happen?
Her family and Canada's Minister for Indigenous Services say it should never have ended that way.
I don't understand how someone dies during a wellness check. Frankly, along with many Canadians, Indigenous peoples living in Canada, politicians, I'm pissed, I'm outraged.
What do we want?
That outrage from so many led to protests this summer in Canada and beyond. With the protests, demands for real change to a broken system, including calls for police forces to have their budgets reallocated, to redirect some of that money into community mental health services, and to change the response for those in a mental health crisis to a medical call, not a police response.
But knowing that somebody at the other end of the phone is going to answer and show a bit of, compassion to them, and sometimes that's all, people want.
Darna Savara-Daly is a crisis worker with the Gerstein Centre in Toronto. For over 30 years, Gerstein has been leading the way when it comes to mental health support for people in crisis.
Gerstein Centre, may I help you?
Offering a 24-hour crisis line and mobile health teams that go into the community to respond and help those suffering in times of crisis. Its model is a non-police response with a focus on listening and hearing people's concerns.
We try to meet people where they're at. We try to be, not judgmental. We try to acknowledge how difficult situation can be for somebody. We try to validate how they're feeling. We really give them that time that they need to tell their story.
And many more services like the Gerstein Centres are needed.
to take the time to do it right.
That's where Asante Houghton and Rachel Bromberg come in. They are trying to fundamentally change how we respond to mental health crises in Canada. They co-founded the Reach Out Response Network, which advocates for a non-police mental health emergency service available 24/7.
So what we hear really consistently is that police are they're not mental health professionals. They're limited in what they're able to provide.
She says her group's research shows that responding with a crisis team is more likely to have favorable outcomes compared to interactions involving only the Toronto Police Service's primary response units, meaning frontline officers.
I think a big difference is the trust that you have in the system.
Asante has been wary of calling police when dealing with his own mental health challenges because of what he's witnessed firsthand, relatives being interrogated instead of supported.
When you're a racialized person, you have a variety of very justifiable reasons as to why you don't have trust with the system, and that's probably because you've been harmed by the system in some way. Not just that the system hasn't served you, but you've been harmed by it.
The visibility of someone showing up in a police uniform, I think can escalate the distress symptoms for someone who's dealing with mental illness.
Dexter Voisin is the Dean of the University of Toronto's Faculty of Social Work, and as we saw in those high-profile cases from this summer, he says race is one of several important factors that make mental health calls so difficult when dealing with communities who are already wary of police.
When you look at the intersection of gender, place, race, and class, individuals who represent racialized populations, poor populations, tend to have poorer, more negative, more deadly interactions with police.
Back in Peel Region, the same jurisdiction where Ijaz Chowdhury was killed, we met with the police chief and the head of the Canadian Mental Health Association. The two groups are working together. Though he wouldn't go into specifics of the Chowdhury case, Chief Nishan Duriappa readily admits that police are not the ones for the job when it comes to many mental health calls.
Do you have anything to say to Ijaz Chowdhury's family who say that there should have been, a better response to the way this was handled?
Yes, and I'll say it again that we too are heartbroken for the tragic loss of life. Our role is to preserve life and to prevent these incidents from happening. But we're not mental health professionals.
Police are still the default first responders for everything from noise complaints to mental health calls. And now, even top police authorities are admitting that the system needs to change and is changing.
Finally, there's broad attention to the fact that we've been seen as the panacea for every social ill, whether it be homelessness, addiction, housing, youth-related issues.
In Peel, police and the Canadian Mental Health Association have partnered to deliver a mobile crisis response team known as MCERT. Crisis workers join officers on mental health calls. The problem is, there aren't enough of them.
Do you think there are enough in Peel Region right now for any given shift? How many
absolutely not. There's 1.4 million people in this region, and we have 2 MCERT cars out at a time.
The chief says his force receives about 7,000 mental health calls a year. The 2 mobile units are only able to respond to less than a third of those. The bigger question is, should the police be involved at all? Earlier this month, New York City announced it's launching a pilot crisis response to dispatch trained crisis workers instead of police for some 911 calls. Other large cities like Denver already have similar initiatives.
Pretty much everybody we see is, for one reason or another, in a state of crisis.
In Eugene, Oregon, a civilian-led approach integrated into the 911 system has been in place for years. Members of a mobile response team, known as Cahoots, are dispatched instead of police when a non-police response is deemed appropriate by an emergency dispatcher or through an emergency line. Cahoots received 24,000 calls in 2019. Police backup was required just 150 times.
We're the wrong entity in the first place. There's a space in there for somebody other than a uniform.
David Smith from the Canadian Mental Health Association, along with other mental health advocacy groups, say the response needs to be flipped so that a mental health call is always met with a health response first, and then a police response if and only if it's needed.
What are police doing right, but also what are some of the mistakes they're making right now?
I think if there's something that police can do in terms of an area of improvement, it's involving us more in those mental health calls, but we don't have the resources to be there. So we need resources, and then we're available. And then I think there's a willingness actually to hand over that responsibility to healthcare, which you don't always see.
Another challenge with mental health is the belief that people in crisis often become violent, so a police response is needed. But advocates for change say that's not the case.
There is a stigma, there is an association that people have in their minds between mental health crisis calls and violence, but in the real world, it just doesn't exist.
What all agree on is the terrible history of those in a mental health crisis ending up dead has to stop.
What's your fear?
My fear is that nothing changes. My fear is that, this moment is a moment and it's not a movement.
Coming up on The New Reality.
The main things I'm still dealing with right now are really disabling fatigue. Even working at a computer has been really difficult.
How many people might be long haulers?
Anywhere in the range of 2.5% of people will still have symptoms at 12 weeks after symptom onset, and that's probably a conservative estimate.
It won't be long before we're looking at 2020 in the rear-view mirror. At some point, the pandemic will end, and life as we knew it before COVID will return. But there is a group of people whose lives may never return to normal. They're known as the long haulers. They got COVID and survived, but are plagued by a multitude of symptoms that are as debilitating as they are mysterious. Robin Gill takes us inside Canada's first post-COVID clinic, trying to solve the enigma of the long haulers.
Katie McLean has a lonely life. She can't go anywhere, can't see anyone, because of what COVID-19 has done to her health.
It's discouraging and worrisome, but all of our lives are pretty different now with the pandemic, but this just takes it to such a different level, and it's very isolating.
McLean's isolation started in September when she tested positive for the virus. Then her symptoms took over. Cough, shortness of breath, a racing heart, and the worst part, debilitating exhaustion. When we met up with the 42-year-old 9 weeks after her diagnosis, she's still suffering from those same symptoms. Even taking the stairs is too much.
The main things I'm still dealing with right now are really disabling fatigue. Even working at a computer has been really difficult. I can't really physically or mentally exert myself without having a relapse of symptoms.
McLean is part of a new group of patients called COVID long haulers, a term used to describe those who have symptoms well after the virus has left their system.
You're considered a long hauler. Does that title worry you?
It does make me worry, makes me worry about, what about the rest of my life and what's that going to look like, and will I be able to resume regular function and be active again, or is this kind of what I'm going to be dealing with for a long time?
You said 1, 0.
It's an eerily similar story to Jacqueline Robinson's. She too is suffering from long-haul COVID symptoms.
He had that one too.
Robinson got sick during the first wave in March, and for the first week she was isolating at home. Her health started to spiral. She ended up spending 8 days on a ventilator in a medically induced coma. And in a warped twist of fate, Robinson, who is a nurse, went from helping patients to needing life-saving care.
Needless to say, I was shocked and scared.
Her husband and kids weren't allowed to visit, and when she finally emerged from the hospital 2 weeks later, Robinson was down almost 12 pounds, and her muscle strength had wasted away.
It is terrifying to have a virus that's completely novel. I am a nurse. I like to make sense of things, and the hardest part of this whole experience for me is there's no answers.
At St. Paul's Hospital in Vancouver, Canada's first post-COVID clinic,
you stand up like that?
Yeah.
The team is doing detective work on the long-term effects of COVID. So far, there's one main trend.
I'm seeing a lot of suffering.
Dr. Jesse Greiner is a general internal medicine specialist and the director of the clinic.
I just want people to feel like they're not alone in this, that we're all sort of in this together.
Is your mind like churning all day long and all night long when you see your patients and you're thinking about this?
I'm at home, I'm trying to research and understand different syndromes and different ideas, and yeah, I'm learning as much from them as they are from me right now.
I'm going to take a big breath in quickly.
The answers may be found in the 160 patients they're treating because they're also the backbone of crucial research.
So I'll explain each test first.
The clinic is conducting its first study of post-COVID patients, and McLean is one of them.
I could breathe, but I felt like I was breathing heavily
For the next 2 years of her life, she'll be going through a series of tests to understand how she became a long hauler.
Do you feel like a guinea pig?
I do a bit because we just don't know how this is going to play out yet.
Every time McLean visits, she'll be getting an ultrasound and ECG done on her heart.
Breathe in.
A CT scan of her lungs.
Big breath in.
Pulmonary tests to see how her lungs are handling the weight of it all.
How exhausting is all of that on top of having COVID?
From being a person who pre-COVID, would be going to work and then yoga classes and seeing friends, and now I really have to plan the day to kind of conserve the energy I have. So it's hard. Yeah, it's exhausting.
So what could be causing the extreme exhaustion?
Really, we don't know the answer at this stage.
That's because the long hauler condition is so new. It's impossible to know how many people could be in this category. But there's a growing number of patients all over the world who say they have long COVID.
I always knew it was COVID, and I was told very early on it was COVID.
Hannah Davis believes she got COVID in March. At the time, she lived in New York City, the epicenter of the virus in the United States early on.
The hospitals were completely overflowing. They really were trying to keep us away from the hospital. They explicitly said, if you're out of breath while you're walking across your room, that's not good enough to come into the hospital.
When Davis finally did get tested, it was 31 days after the onset of her symptoms.
When I got tested, the doctor said, this isn't really worth doing. After 14 days, these tests are worthless. This is going to come back negative, and it did.
Davis is now part of a long hauler support group, many of whom say they were infected but told to stay home, so they never had a positive test.
The more common experience is that you get a negative test and your doctor says, oh, it wasn't COVID. It must be something else, and then you're on not only a goose hunt for what it actually was, which was COVID, but you're also just paying insane medical bills.
How many people might be long haulers? Do you have any sense of numbers?
Yeah, I mean, if you believe the study in the UK, it sounds like anywhere in the range of 2.5% of people will still have symptoms at 12 weeks after symptom onset. And that's probably a conservative estimate because some people don't even recognize that the symptoms that they are having are related.
In the scientific world, the closest thing doctors have to compare COVID-19 to is SARS. And there are only a handful of studies looking at the long-term impacts of the 2003 outbreak on those who recovered. A University of Toronto report followed 22 people with SARS and found they were not able to work for almost 1 to 3 years after their infection. Participants had persistent fatigue, muscle pain, and depression.
What you're doing is physically right.
Researchers at St. Paul's Hospital say those studies are helpful, but they're not enough to understand this new virus that is likely permanent.
COVID is really here for the long term. This isn't something that we're going to have go away through good infection control policies, which essentially is what happened with SARS.
Dr. Christopher Ryerson is a leading expert in the study and treatment of patients with lung disease.
The vast majority of people will have normalization or very near normalization of any symptoms over the coming months after their initial acute infection. There will be some people who are quite unwell who will have persistent scarring in their lungs, and that could have an impact.
Have you taken anything for the fever?
Jacqueline Robinson is now back at work. It's been almost 9 months since her time in the hospital. She has good days and bad, but Robinson still doesn't know if this is her new normal.
Do you think you still fall into the category of recovered?
I feel like I'm recovering. However, I still feel the impact of the virus in my body, and I'm not back to my baseline. I still feel permanently changed.
It's the reason Robinson has teamed up with the post-COVID clinic at St. Paul's, both as a test subject and a nurse working in the clinic, so she can see this disease from the lens of a medical professional and a patient.
The thing that's interesting about my case is they don't understand why some people under the age of 50 with no other chronic health conditions could get such a severe impact, like severe version of this virus.
I can tell you that I'm seeing a lot of people under the age of 50 that are having sort of ongoing symptoms. I'm seeing people over the age of 50 as well.
Coincidentally, both Robinson and McLean are the same age, 42.
Okay, anytime you're ready.
For Katie McLean, she's focused on getting better. She hopes the testing will one day help her escape the impact of COVID and the waves of exhaustion that rule her life.
It's going to be a long haul for the research as well. Are you prepared for that?
I think advocating about it is really important, and being a part of the research is really important to help other people, you know, and hopefully the more we know, less people will have to go through this and have their lives kind of severely turned upside down by this infection.
Next week on The New Reality.
I didn't really feel like human. You make money so that you can live, but I wasn't making enough money to live.
What a basic income does is provides a foundation from which people can grow. You see entrepreneurship, you see employment, you see people doing better in their lives overall.
To have the capacity to live the human experience and have relationships and have a healthy lifestyle. And it's really hard to do that when you're poor.
Every Canadian deserves to live in dignity, and in a wealthy country like ours, we can afford to pay for it.
And that is the new reality for this week. Thanks for watching.